Hi, everyone. Thank you so much for joining us tonight. Welcome to our last Parent Speaker Series event that is a partnership between CTC, or Communities that Care of Greater Downingtown, and the Downingtown Area School District. My name is Christy Jambowski. I'm the Prevention Program Coordinator for CTC, and we're so happy you're here with us tonight. So as you can see, hopefully on our screen, and I might have to make sure that, yeah, we're in gallery view. So you should see we have many experts with us tonight to share some to-dos, some tricks, some tips, some positive energy and sharing about a wellness reset for summer after such a unprecedented, to use the word of the times, school year. So with that, I just want to say that we did collect some questions ahead of time during our question and answer section, and we're going to be sharing resources and tips from our experts at the end of our session tonight. But also please know that you can use the question and answer button at the bottom of the screen. And so we'll be trying to answer the live questions as priority since you took the time to be here tonight. So please ask away and put them there, and we'll get to as many questions as we possibly can. And so with that, I'm going to pass it to Sarah Brooks from Downingtown to share for a minute.
Hi, everyone. Thanks for joining us this evening. My name is Sarah Brooks. I work with both Student Assistance Services and our District Wellness Committee at Downingtown Area School District. For those of you who are joining us for the first time, I want to thank you for giving your attention to this important information on a nice evening. And for those of you who perhaps are returning to us, I want to thank you for doing that too. I was actually thinking earlier today, I think about a year ago, we were having a similar conversation and just trying to prepare for a summer that was very uncertain. So certainly we're in a different space now, but still trying to sort of regroup. So I hope the information that you received tonight is informative and helpful, and we certainly appreciate you joining us. Dr. Sinelli?
Hey, thanks, Sarah. Thanks, Christy. Hello, everyone. Again, also would like to say welcome. Thank you for joining us for Communities that Care of Greater Downingtown and the Downingtown Area School District Parent Speaker Series. We've had a number of different programs this school year on many different topics related to mental health and substance use prevention. And as Chrissy mentioned, our final program this evening is with a panel of experts from our community who are working with youth and families around many issues that we've talked about this year, but also will be helpful with some things that we can think about this summer as we reconnect with families in a more summertime state of mind, and have the opportunity to also think about some things getting set as we prepare also for going back to a new school year. So what I would like to do right now is I will be asking each of our panelists to introduce themselves, and then to also give us a very brief overview of who they are and what they do and who they're working with in our community. So I'd like to start with Priscilla Singleton.
Hello, it's a pleasure to be here and just enjoying our panel already prior to the start of the evening. I am a family therapist, and I work for Council for Relationships. I also teach at Thomas Jefferson in a couple and family therapy program. And I work with individuals, couples, and families. And I'm here tonight to learn and to also share from the experiences I've had with families that have taught me so much, and then to maybe offer some tips toward the end of how we continue to move through these extraordinary times. So thank you for having me.
Thank you, Priscilla. And Dr. Benjamin?
Hey, it's great to be here. I always love coming to participate in Downingtown and, you know, the activities that you guys offer. I am the clinical Fidelity specialist at the Philadelphia Child and Family Therapy Training Center, and also one of the clinical trainers. We train the family-based therapists across the state of Pennsylvania. And I also am an adjunct at Rosemont College, and I have a small practice where I specialize in family therapy, life-threatening behaviors, and children with multiple failed attempts at mental health treatment. So I'm very honored to be here with Sarah and Chrissy and Dr. Senna. Thank you.
Thank you. Thanks, Dr. Benjamin. And I'd also like to introduce you tonight, Dr. Belamorich.
Hi, I'm Dr. Belamorich. This is my first time at one of these events, so I'm very happy to be here. I am a physician at Christine Meyer MD Associates was at Healthy Steps Pediatrics as well for about 2 years. And then due to scheduling conflicts, I'm now just at Christine's practice, but I do see adolescents there as well. And I was lucky to train under an in-house psychologist during my residency, so I've worked with a lot of adolescents and children and adults with mental health issues.
I wanted to, if we, just want, Dr. Belamorich, I'm not sure about the audio, like mine, it was cutting out a little
Oh, I'm
bit for
sorry.
me. And I don't, but I'm sorry, because I wasn't sure if it
No.
was, I have a new laptop and I just am checking because I don't want to miss your
When
introduction.
you leaned in, we could hear you better.
Yes. So
Is
if
that
you don't
better?
mind, if you don't mind, yeah, if you
No,
don't mind.
that's fine. Is that better?
Because we want to know who you are. Yeah, perfect.
Okay, great.
We're good.
I'm one of the physicians at Christine Meyer MD Associates, which is a family medicine practice in Exton. And for 2 years, I was also on staff at Healthy Steps Pediatrics, which is kind of the side practice as part of Christine's practice, seeing children as well because I am family medicine trained. So I worked a lot with adolescents and children there, and I do still see teenagers and adolescents on Christine's practice.
Good. Thank you. Perfect. Thank you. It's nice. Thank you for joining us. And I'd also would like to introduce Jan Michener.
Hi, thank you. I'm Jan Michener. I'm a mother, a grandmother. I was a teacher, and I'm the founder of a nonprofit, Arts Holding Hands and Hearts, AHA for short. And we bring mindfulness-based movement awareness programs and expressive arts program to youth that are in the juvenile justice system and also to children in Head Start. And we also bring trainings of mindfulness, self-care, wellness, and resilience to parents, caregivers, and teachers and other organizations that serve children that are impacted by trauma.
Thank you so much, Jan. And I'd also like to introduce Jan's colleague joining us this evening, Amanda Daley.
Thank you. Thank you so much for inviting AHA to be here. My name is Amanda, and I work directly in the programs that Jan mentioned, work with the youth at the Chester County Youth Center, and work with the youth at Head Start program, and worked with youth all the way from little bitties to high schoolers. And I bring a focus around mindfulness and how we can be comfortable with our feelings and what to do with them. And I'm excited to be here and be part of this panel. So thank you for inviting us.
Thank you all. We're really excited because this is just a wonderful group who bring expertise from many different areas, but yet seem to bring everything together. When we talk about a whole child and a whole school, whole community model, it's really nice to have our school professionals and our community professionals come together to talk, sort of tie everything together that we've talked about all school year. So welcome and thank all of you. And I know that Chrissy has the next part of our program, which is answering some of the questions that have been submitted to us by many of you this evening. Thanks,
Yep.
Chrissy.
Thank you. Yep. So I'm just going to go through down our list and feel free to jump in. And I know if some of you have participated in this platform before, but we're hoping just to have, informal discussion, dialogue, those things. And for those of you watching, please feel free to use that question and answer tool to ask questions as they start to come up, and we'll try to make sure to get to them. All right. First question of the evening. So as we return to normal, if my child struggles to go outside or interact with friends in person, what are some strategies that I can use with them?
Well, I'm happy to get us started on this one. Gosh, if this is happening with your kid, y'all are not alone. This is something that I have been, as I'm sure the other panelists have been talking to caregivers about with their children. And one thing to really think about is sometimes there are just right in the neighborhood people who they might even be able to practice getting out of the house to say hello to, practice getting out and going to places as things change in terms of face coverings as well. And so we have to remember that although we could do all of these things beforehand, if you're having somebody who's struggling and feeling uncomfortable, don't worry about getting them back to where they were right away. Think about small ways you can move them forward. If you have a pet dog, talk to one of the neighbors and find out if they're comfortable with you bringing the dog over to their house with the kid. So that way the kid practices interacting with somebody, again, all of this within, your own personal comfort zones, but think about starting small and then working your way bigger. Don't get bogged down by on like what they were able to do before, because everybody can get back to where they were at.
I think also thinking about as a parent, how comfortable are you in giving yourself the time to re-enter? Because I think our children are always watching us and taking cues from us. So maybe folks around you are moving very rapidly and you need more time. So I guess I want to say take care of yourselves first, and then your children will feel that security and that confidence once again as we move into this next phase. As much as we have all been waiting for it, I have phone calls and appointments all the time, and it's like, what does this mean now? The CDC is saying this, and everybody personally having to get their comfort, and then I think our children will take comfort from you.
I just wanted to add to what Priscilla was saying on that I just think it's lovely, because what you're talking about is figure out on that day where your rules and boundaries are and follow them so your children can mimic them, right? And as things keep opening up and your boundaries and limits shift, just make those decisions and model it so that way they can follow along.
Dr. Belamorich, did you want to add something? I saw that your little thing lit up.
I was just going to add, making sure that it's something that your child would be excited for and would be interested in is probably going to help as well, because if it's something that they are looking forward to, they'll probably be more comfortable in and happy to do that versus, focusing more on that they're nervous or anxious, it would be something that they'll be ready and excited to do.
Okay, I have a live question. Thank you for the first. So I don't. Can you all see the live questions that come up in the? Yes, maybe, maybe not. Okay, I'll read it. I'll read it off. Okay, so this is for someone who has their child is in 6th grade. So my daughter's friend used TikTok to bully another girl, and her mother took her account away temporarily. My daughter then had issues with this friend, and the group froze her out and talked about her. She is now worried that this friend will use TikTok to bully her, and she has developed anxiety about going to school. What resources are available to tap into? Oh, the social media. I think you all can see it. Possibly if you click on the question and answer, maybe you might be able to read it if you want to read it.
Sarah, I might pull you into this one. I feel like, this has actually happened about 15 times in the past couple months. So there's 2 different things happening in this scenario. We're talking about the anxiety that's keeping the girl from possibly venturing back into the school. And then we're also talking about managing conflict. And so the one thing I think about, Sarah, I mean, you and I have known each other a long time, and there's always been a great, I've always had a wonderful experience with encouraging parents to turn to the guidance counselors. And the big thing I would say is if you're turning to the guidance counselor, bring the child into the school to have the meeting with you. So you get them to push through that impasse of anxiety they're having initially about being frozen of going into the building. And I didn't know, Sarah, if you wanted to speak to that at all before I gave any comments about the second part.
I mean, I think I would highlight, just to piggyback off of what you're saying, certainly within all of our schools, we have school counselors, as well as in most of our buildings at this point in time, we have prevention specialists, but also even our administrators, which not everyone always views them in that sort of light, but I would encourage you to reach out to the staff in the school, especially as Dr. Benjamin was referencing, if it's starting to create a problem where we're concerned about coming into the building, that really is where a partnership needs to develop. And it can be as simple and very similar to some of the comments earlier about creating some of those brief exposures in the community. It might look like coming into the school and just having a brief conversation with the counselor or a trusted adult in the building, just to sort of break down those barriers. And then I would say through some of that dialogue, there's probably maybe some additional conversations that need to happen as far as the peer group and conflict resolution and those elements, which I think that's probably where you're headed.
Yeah. Yeah. It just, kids just need some of these things remapped for them. The neural pathways are there, right? I see Priscilla shaking her head. Yeah, right. Like you got to knock the dust off, and we got to get them back into realizing that, the conflict isn't going to cause them to implode, and we can prepare them for those interactions and have resources built into their school day. So my big takeaway would be, don't avoid the school. Make sure you move through that impasse of anxiety, because that is crucial.
Yeah, I think the only thing I might add to that is also, I'm just thinking sort of developmentally and at the age that we're talking about, especially in sort of that 6th grade age range. I think a lot of our kids, obviously, as we know, have had earlier exposure to technology and social media, and then reality in the past year because of COVID is our kids have been doing even more through technology and social media as a result of the pandemic. But I think that's a really good teachable moment to be able to create some dialogue around sort of our friendships and the meaning of our friendships, and our friendships that are like developed in person versus over social media. All of those conversations, which I think are really crucial, especially at that age range, and will really just build over time and as kids mature and grow up.
Sarah, that's something I was thinking about too, that this time has given all of us that time out to sort of reassess what we have valued, what's important. And it's a nice skill to begin teaching our children to really review, who have I decided is my inner circle? How has that worked for me? Have there been other people that could be possibilities? And so I think that is another piece of it too, to reassess what's best for me today, returning back to school. And maybe there is that person that invited me once or twice and I didn't pick up on that. And again, this reevaluation of what we value and what makes it a good friend. Yeah.
Like scanning all the microphones to make sure everybody that wanted to share. Okay, thank you. And thank you for whoever submitted that question. I hope that was helpful. Okay. So the next one is kind of 2 questions. It was a similar theme that we were seeing, kind of going right into more about screens and asking about screens and video games. So a parent sent a question in and asked, I have a 10-and-a-half-year-old son, and I see that he has no motivation to do anything. He is happy only when he is playing video games. Other than that, he's always grumpy. How can I help him find joy in the little things? Wants to go?
I think that we can really model that as parents. We get caught up too in what is going on in our life, and we lose the joy in the little things, right? So it can be as simple as when you walk outside, commenting on how beautiful the day is, or that you can feel the sunshine, or that you can smell the flowers. And the more often that you as a parent in interaction with your child can recognize the beauty of the world around you, that you can laugh freely, that you can invite conversation about what's going on that's bringing you joy, and share that, I think that's impactful over time. So what can happen is that we say, okay, today I'm going to point out all the things that bring me joy to my child, and there's no shift. And then we get discouraged. So it's really a practice of noticing those things, pointing them out, and trusting that over time there will be a shift. So I guess that all sums up to, if we can model finding joy in things off of our screen, away from our computer, away from our phone, and verbally express them, I think that that will, root in there.
I just wanted to piggyback off of that and add that I love how you like really painted that picture. And one thing for people to think about as we're trying to move kids off of screen more, because there's this apathy that is set in where they're just not, seeming as motivated to get off the screen. Learning to transition from a screen that gives instant gratification by pushing a button to an activity, that is a skill that children learn. It has to be taught. And it is a skill that has really fallen to the wayside for many people, including adults. And so I really like, Amanda, how you punctuated, don't give up on it. So as you start chipping away at this challenge, you need to realize that it's going to take continual effort. I would encourage you as a parent to have like 1 or 2 people you talk to ahead of time, like co-parents. Like if you don't have one in the house, find somebody, a friend or in the community, where you already let them know, like, hey, I'm going to chip away at screen time starting tomorrow. So if I text you and say, I want to pull my hair out, I need you to tell me to stick to the plan. And so there is this, if they're transitioning from the screen to something else and they're complaining, don't get pulled into that. Focus on what they are doing. And, thinking about what Amanda said as well, as you're teaching them how to transition, also have a couple activities, even if it's pick up sticks, sitting together and reading a book, even if they're miserable the whole time, right? They literally have to relearn how to re-engage or reactivate. How do I engage in things other than screen? And this takes time. And think about because listen, I'm a parent, totally get the screen time. I'm not going to act like it's not a thing. Think about the period's length of time that they're on the screen. Some kids, they go past a certain point and they become like little gremlins once you try to take it away. But if you can transition them in chunks, not have them go past a certain length of time, then they tend to be less agitated. I mean, anecdotally, I usually see it around the 45-minute mark is a good time to transition kids into a different activity, or like Amanda's saying, getting them outside. I mean, but just little things to think about.
And I just want to piggyback on both of you is as being both a mother and a grandmother, is sometimes we get stuck on looking at our children at what maybe be pushing our buttons of things that we, that are the things we don't like about them. And we forget to shift to look at the things we really love about them, and the things about their strengths, instead of we're looking at they're not maybe measuring up to what we want them to be. And so it's like shifting our mindset to start focusing on those things that there are their strengths, their gifts, and acknowledging them, because we're so stuck on looking at the things that are pushing our buttons that we miss those things that they are doing. And then if we can shift, then it helps them maybe shift more to also seeing their strengths.
And Priscilla, go ahead.
Yeah, and all I was going to say, Jan, as I was thinking about it too, there was a time where this child probably did have joy in something other than the technology. And I think that reminiscent time, to go back to a time to remember, and that felt sense of maybe a picture of this child enjoying being outside? And do you remember that? Not forcing them to do that, but just to remind them that there was this time where there was this freedom and this joy around some more simple things. So even rewriting the narrative back to something that they would have remembered and could take some joy in again.
And kind of just another question that someone else asked that sort of ties into this that I just wanted to add on and ask was, somebody asked, kids have been very complacent physically this year and very tied to their devices. How do we help them feel less tied to them and deal with FOMO, so the fear of missing out, and just kind of to be more physically active and to engage, I think, in more things than just that need to be just so tied to it. And I'm assuming this probably also thinks more of like social media, maybe more adolescents that might have those accounts, and that's where their social life might also live, right? So any tips for that, or kind of to break, not fully break up with your phones, but take a break from them? I don't know.
One of the things that I usually suggest with patients and families is maybe doing a no tech night. So everyone kind of puts their phone or tablet or screen aside just for a short period of time, and you pick something to do together, something obviously hopefully that everyone enjoys and will get a good feeling from and look forward to. And it also sets the expectation that that for that time you won't have the access, but we'll do something fun, we'll go somewhere, we'll do a physical activity, try to get it's kind of ties into number one as well, where we're trying to get people back into social situations and being outside more and kind of breaking away from that.
The other thing I think about too, and we're thinking about FOMO, right? Creating space for your child to talk about, even if we think it sounds ridiculous, it doesn't make sense to us, and we're like, who cares if you miss their live 30-second cup stacking, balance water on their head moment? What does it matter, right? And it means it doesn't have any meaning for us. I think it's an opportunity for parents to connect to what does it mean for the child. So I always encourage parents to first validate and acknowledge what's important about it to the kid. Ask what and how questions. Don't ask why. I've never asked anybody a why question and gotten an answer I liked ever. Saying, well, good, right? I mean, that doesn't go well. So, but ask a what or how question. And, because sometimes you find out, oh, you mean in 15 minutes, you wouldn't mind getting off and walking the dog with me? Okay, great. Let's do that in 15 minutes, right? Just make sure you don't get sidetracked and pulled into your own social media, right? Because I want to do that.
I think that's the big thing, is the role modeling goes back to it, right? I mean, and I will just share this story because, I did read the book called How to Break Up with Your Phone a couple years ago. It came out, very good book, very quick read, very actionable items in it. But I remember I was looking, and I try not to be on social media until like end of day, because it's very distracting. It sucks you in. And I remember looking at something, and my son came out of his room after bedtime, of course, right, 5,000 times, and comes out and is like, "Mommy, who is that?" And it was like a stories on Instagram. And I was like, "Oh, it's this celebrity. It's just a story or whatever." She's like, "Do we know her?" No, we don't know her. I have no idea who she is. She has no idea who I am. She has no idea we exist. I'm like, if that isn't a child showing you just, kind of writing your perception of things, of no, we don't know them. We don't know the people in this video. They don't know us. I just like to share that story because, again, it's one of those things where you can also learn from them as we go, right? It's just kind of funny. But okay. All right. So moving on. Okay. Okay. So now with the new CDC guidelines, right? So more of a medical question. Well, maybe not. I don't know. How do I explain to my child that some people may now be wearing masks and others may not?
I'll take this one on. So I think obviously you want to be age appropriate with your answer there. So, you know, younger kids are not maybe going to understand quite as much as older kids in terms of what the CDC is and what they do and guidelines and things like that. But I think, so trying to keep it age appropriate and explaining, you know, just like I have brown hair and, you know, Aunt Kim has blonde hair, you know, people are different and they have differences with health as well. And so some people may be more comfortable wearing a mask and some people may not need to wear a mask. And that, you know, is based on our guidelines is becoming okay and, you know, not villainizing anyone and making sure that your child, you know, understands that as well. And encouraging open dialogue and questions and making sure that, you know, you're validating how your child feels and making sure that they can, you know, have conversations with them and, you know, they feel comfortable enough to come to you with questions or even just fears or anxiety that they might have about that.
I like, Megan, how you punctuated about the, you know, children coming to their caregivers about their fears and anxieties. And again, I would really encourage caregivers that when your child does come to you, don't try to make their fear or anxiety just go away and say, oh, I'm already wearing all that, or like, yeah, it's no big deal. Reflect back to them what you just heard them say. I mean, sometimes you can literally repeat it back to them. And it is really powerful for a child to hear what they're saying out of the mouth of somebody else because it accesses a different part of the brain. And it will really get them more into their front brain. So then you again can be curious about it. Because sometimes you find out it's because, well, you know, because Tony said blah, 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 and Joey said this, and Sally said that, and I don't know, and da, 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 and the bus driver, and it's this whole, you know, silly thing, but they just had to say it. And sometimes there's something scary they've been told or something scary they saw on social media or on the internet, you know, whatever is happening. So I would just, in those moments, right, you can storyline it. And if they're presenting as nervous or anxious, just be curious about it. Try to understand, you know, what is making them nervous.
Anybody else? No? Good. Oh. Okay.
I was just going to say that I think sometimes too, when anxiety is sort of the lead, rehearsing, you know, what do they remember about the mask? Why did we put the mask on? Do you remember what that was about? So what do they remember? And then what we're changing right now and what we are thinking about right now, but sometimes even helping them to access what they already know and just being able to talk about it out loud, you know, Jennifer, like you said, but to hear themselves and to remember. And I think that the other piece is they have heard so much. I mean, with social media, the news, it's really been devastating. I think we forget how traumatic this has been, the loss of life. And, you know, so many worried that they're going to make somebody else ill, whether it's a sibling with some kind of pulmonary issue or a grandparent that they love so much. And they've carried the weight of just so much. And I think we feel that way. You know, this was our protection and now that's gone. So I think helping them access what they know. And then, as you said, it may help them think about what happened today that you're thinking about it today, and, you know, to try and help them connect those pieces.
All right. So do you have any specific activities or strategies to start practicing in the summer? Maybe short stress management or mindfulness things to do now and be familiar with for the start of school. So I guess kind of things that we can start habit stacking or putting in place now in preparation of, not that we want to think about school for the fall, but, you know, things we can do this summer.
Well, Jan and I are going to share some tools in a little bit. What I would like to offer for, you know, as we start to shift our mindset a little bit as we go into summer and think about the fall is it goes back to me for modeling. And when our children have fears, anxiety, worries, we want them to tell us, right? We want to know, and we can see it all over them. And it hurts kind of when they say, oh, it's nothing, or they don't want to talk about it. We do the same, we can do those same things to them, right? When they ask us what's wrong, it's because they can see it all over us. And we say, oh, it's nothing, or I'm fine. And the reason that we're doing that is because we don't want to burden our children with whatever's going on with us. However, if we can start not dismissing our feelings and validating our own feelings, so it becomes a conversation that's normal in our household. So, oh, mommy, what's wrong? And say, you know what, I am feeling a little nervous about going to this gathering. And I know that I will be okay. So I can feel nervous and I know that it's going to be okay. And then I'm going to be brave for this, or I need a hug, right? And so being able to say how I'm feeling as a grown-up, and maybe even making a request of what would make me feel better. Can I have a hug, or can you sit with me for a moment, or can we take a breath together? That empowers your child to feel like, oh, they can be helpful to you. And you're not always the one saying, I'm fine, but I'm going to take care of you. And this is what you need to do. So I think that as things are changing, we've been talking all night about things changing and anxieties and fears. It can be a really powerful practice for you as a parent to start just acknowledging your feelings. Stop telling your child you're okay when you're not okay. That doesn't mean you need to be like, I'm losing my mind. It doesn't mean that you need to really put all your feelings out there like very intensely. Rather, you can take a moment and acknowledge that there is something there, because that's what you're hoping your child will do for you when you ask them how they're feeling.
Well, that was really well said, Amanda. I love everything. The other thing I think about for things to do in the summer, you know, like, I just think about little things. You know, don't think that for it to be a strategy or activity that has to be a large experience, like Amanda's saying, right? Like, sometimes it's a 2 or 3 second comment, interaction, gesture. You know, even if they are on their screen and you want to invite them to come out, go sit down next to them and say, oh, tell me about what you're playing, right? And they're like, I can't, if I die, I can't restore my world. It's like, oh, so when you die, I'd love to hear about your game a little bit, right? I'll just be in the kitchen. And then they tell you about their game and you're like, oh, well, let's go outside together. I think that's the other thing that is opportunity for in the summer. I would really encourage all the caregivers out there to be prepared to like play with the children, right? At lots of different ages, even if they're teenagers, right? Go outside and do some sidewalk chalk, even if they're teenagers, right? And if they're so weird, I'm not doing it. Like, sit down anyways, get your butt pillow out and sit it down on the driveway and start drawing, you know, but think about being prepared to do things with the kids, even if it's a walk, even if it's sitting outside with a glass of lemonade because of your own limitations, or sitting outside and have them create a playlist for you guys to hang outside with. They'll come up with something really great to listen to.
Any others?
I was just going to add, sort of to piggyback off of both of those pieces. I think sometimes we feel like we either have to create or force conversations. And I think probably, the takeaway in my mind, listening to both what Amanda and Jen said, there's a lot of opportunity for conversation in those moments of just doing something else. And I think for those of us, especially for those of us, like I know in my work and having worked with kids for years, one of the many things that I often did was like walk and talk. We go outside, we get some fresh air, we take a breath. We're not actually like looking face to face at each other actually. And it's amazing how that experience can really kind of open the door for some meaningful conversation. And obviously you have to be listening for those opportunities, but it's funny because kids will tell you a lot of things. You just have to kind of be willing to create the space. But again, I think similar to what both Amanda and Jen were saying, sometimes those little things of just, like you said, going out and doing the the sidewalk chalk or the driveway chalk, or just going outside for a walk can really open some doors for some meaningful conversation.
And I was thinking with, so my children are much older now in their 20s. However, we probably had our most powerful conversations and memorable doing something else. And it could have been driving in the car, listening, as Jen said, we're trapped in the car. And, sometimes that was very interesting conversations that would happen at those moments. But things like, we spent a lot of time kayaking, paddleboarding, hiking, skiing together, any of those activities. It was so much easier to talk about. It's some things that might have been uncomfortable or sensitive topics, or because we weren't like sitting at a table staring at each other across from something. And so we'll talk about that now, that they were some of the best ways to handle those kinds of conversations. And it just, would just happen. So I kind of, for us, that seemed to work. And they even remember that now, and they're in their mid and late 20s. They'll say, hey, I remember that conversation we had at the beach when we took that walk. It's like, yeah. So that was a good strategy for us. So we kind of build in.
Good. Okay. So kind of off of that, maybe another question was, as far as what words, kind of thinking about, I guess, starting conversations or kind of nurturing that, parent words. So what would maybe be helpful words and those to avoid to not increase kids' stress or worry? So maybe a kid that might be feeling worried, anxious, stressful, what would be some tips on some words to use to avoid those types of things?
One thing is never say, calm down, or, negate what they're feeling, or you'll get over it. Don't feel that way, negating what they are feeling. And what, it's how the weather changes. I liked when when AHA does workshops, we go, what's the weather inside? And just acknowledging, what are you feeling right now? But also acknowledging, what are two things you're feeling right now? Because we don't feel just one thing. Often we feel many different things at the same time, and getting them to actually say, what are you feeling? Can you name that emotion? Then we can tame that emotion. But it's when you say, what are you feeling? I don't know, so getting them actually to give words, to name it, what are you feeling? But I like to say, what's the weather going on inside, and it's like, it's a stormy weather, or it's like, it's kind of sunshiny, but there's some rain coming down. Well, okay, let's talk about it, acknowledging it.
Anybody else have anything to add to that?
I have my favorite one. So I always encourage parents to not use the word but, right? So remember, but stink, right? But stink. So think of it this way, right? You say to your kid, you took the trash out, but you forgot the recycling. It immediately sends the message that all your effort has been kiboshed and nothing you did is enough. Instead, you say you took the trash out and you forgot the recycling. How can we get the recycling out to the curb? Right. So I encourage parents to strike the word but and put the word and in. It's also great for emails. You know, I use it with my husband all the time, and he goes, "Are you doing that skill thing with me again?" Right. You know, it just really changes how you can say you're hearing, you're acknowledging, and then also challenge for that correction to occur or that next step to happen as well.
Anybody else? That's a good one. Should put it on Post-it. Just say and. Swap it out. Yep. That's a good one. Okay. All right. If anybody has any live questions that they want to ask too, it looks like we might have from the ones that were sent ahead. If we might have time for one or two more, if those of you watching, if you want to add them in real quick before we move on to our last section. But okay, another question. So what might be some reminders for parents to get help early, things to look for in their kids, and how to reach out at school or to a pediatrician or a mental health specialist? So maybe red flags or things to look for that might be a trigger or sign to reach out to a professional.
And I might be able to add a little bit of context in the sense, I think Dr. Snelly and I were in a conversation yesterday actually with some district staff, and we were talking about the fact that certain words have become kind of frequently used in our just culture. And so you'll have kids say, and parents as well say at times, terms like depressed or anxious. And I think we as mental health staff sort of make some assumptions based upon that language. And then in other, obviously, populations, it's meant very differently. And so I think one of the things that we were hoping to maybe just be able to provide some feedback on is like, at what point should you be concerned? Or at what point is either what your child's feeling or your child's behavior kind of beyond the scope of what we might be able to perceive as normal, and you maybe need to reach out to somebody for additional professional help?
I guess for me, what I also think about is sometimes you don't need to know that there are these definite signals or signs, but to introduce the idea in almost a preventative way that sometimes when there's a lot happening around us, sometimes it's good to seek out the advice of someone that can just listen from a very objective point of view. So we don't even have to make it a scary thing, like something's terribly wrong, or, and a lot of times I work with young children as well. And when they ask, what do I do? Why are we here? And I said, well, sometimes families get stuck. Sometimes they just get stuck. And that sometimes sitting in a room together with somebody who doesn't live in the family, maybe I'll see something that can help you get unstuck. So to begin to normalize the process too, so it doesn't have to feel like something really awful has to be happening. And then sometimes too, if there is something underneath, it's going to be a space that's going to feel safe over time. So I think normalizing the idea about why people seek out counseling, and that a lot of times parents are using counseling, and for them to be able to say that to the child that, well, I have someone that I talk to that helps me figure these things out. And they told us about a person that sits with families. So again, to normalize it in a way that just makes it a part of a healthy part of growing up for all of us.
And someone just asked, actually, what do you do if your child doesn't want to seek help, but you know that there is a problem?
I think it depends on how old they are, because there obviously are different laws and regulations regarding that. However, regardless of the child's age, 16. So I have always encouraged the parent to offer to go in with the child 2 sessions. because a lot of times kids will say, I won't go, I won't do it. And then when you say, well, we're going together, and they can sit with their arms crossed in the corner and refuse to talk. And a lot of times, once you get in the habit of going, you know, the therapist is able to spend a couple minutes alone or connect or join with that individual. And so I would just encourage that the parent be a part of the process. A lot of times, part of the stress is something we're not even aware of. We might have said or did or didn't do. And so then you become a part of the problem solving, a part of the solution, and the therapist can help put you in a position of being a natural support for the child. Or the parent can seek out some parenting intervention, you know, kind of like the stuff we're talking about today, where they go to a therapist and say, this is what's going on, how can I be helpful? And they can, you know, a therapist can walk you through specifically ideas to help with that challenge.
I think another thing sometimes is to think about, are there other adults in the child's life that they trust, that they can talk to? And it wouldn't replace the therapist, but this idea of reaching out to mentors or someone else that they can share what they might be struggling with. And I really look for bridges all the time, you know, that we really have to build community, because I think one of the greatest losses, I think, of this pandemic has been the isolation for families, for our kids. And so really beginning to build bridges back. And so there may be a teacher, and they may be a 10th grader, but they loved their 8th grade teacher. It may have been a neighbor that has moved away, but they still remember them. So to help bridge this idea, you can trust people outside of the family to be there for you. And then maybe there can be this gentle move toward a more therapeutic relationship. But I think I'm just so aware of the isolation for everyone during this time, and finding our way back, you know, to community.
All right, we're doing good on time. Okay, the last question, because someone asked it, so it is looking ahead to the fall. Not that, I mean, we're all just trying to get through this school year, but you know, can't help to, who knows, you could go back and revisit this last section, you know, in August or something. So what might be some things I can do to prepare my child for school in the fall? Any strategies to rehearse or to get parents and kids ready for the school routine again? No takers?
Well, I would say on a practical level, not waiting till school starts to get back on a routine. So if you know that school starts, you know, August 20th, I'm just throwing out a date, maybe 2 weeks before, we start reining in bedtime routine, or reining in, you know, when we turn off the screens, when we come in from outside, when we, you know, finish our last snack, whatever your routine is for the school year, start implementing that again before school actually starts. Because I know for my kids, they get a later bedtime. My kids are younger, so 10 and 8, but they get a later bedtime when there's no school. But I don't want them to go from going to bed at 9:30 one day to having to go to bed at 8 the very next day, because it's just not going to work. So what I've always done is just a little bit earlier, like take a couple weeks, so that it doesn't feel like this big, huge change. Instead, you know, the couple weeks before, start just little changes that gradually get you back to your whatever your routine is at home that you're comfortable with for a school night.
Also, you know, at the end of the year, you get like a list of books that you're supposed to read before the you know, the new year. Well, this is something that can be part of the summer fun as well, is to get the books at the beginning of the summer and create activities and maybe read the books with the kids and create, fun projects around it. But also maybe this is also a way to reach out to maybe some other children that are in the same grade, and let's do a book club for the summer, or let's create an activity together of that they miss this socialization during the school year. And now during the summer, how can we create activities around it as our own, book club and book activities, and let's create fun around it rather than wait until the week before school starts and, oh my gosh, I haven't read the books, or now it's panic time going into school. Let's create this as a fun time together.
I would also encourage parents to keep wake up routines and bedtime routines in the summer. So if you have a way that you wake up your kid for school, like you give them a 5-minute warning, I know my daughter and I have a thing that we do. So continue that in the summer. Don't throw it to the wayside just because it's the summer. I would also encourage parents, when you get a week or two out from school starting, start having discussions about the story of school and them getting up, getting dressed, grabbing what they need, getting ready, where they're going to sit. Ask silly questions using your what and how, like, oh, what do you think you're going to want to eat for breakfast? I don't know. It's 2 weeks away. Well, do you want to eat sardines? Like, we've got to know these things. Or, where do you want to keep your book bag this year? Who's going to be responsible for your Chromebook getting in your bag? Are you going to buy this year? Like, what do you think about packing your lunch once in a while? Like starting to have conversations, because every time you have a conversation, they're going to build a bit of the story in their mind. And so it's just creating exposure to that transition that's coming up. And as you get closer to the actual day, I would do a couple role play run-throughs,
And I would also do both. What are you most excited about? But also acknowledges, what are you most afraid of? What's the worst situation that you're afraid might happen? And actually have them do their fear list of all the things they think that might go wrong. And then say, okay, these are all the things that might go wrong. Now, what's the worst one that would happen? Okay, what could you do that could help prevent that from happening? And then what could you do that even if that happened, that you could repair that? So they're already letting them see that maybe they already have some strengths and building the resilience ahead and letting them think through that,
I was just going to add to or kind of highlight, along with everything that's already been said, I'm especially sensitive for those students and families who have literally been remote or virtual this whole entire school year. Those kids have been out of school for quite some time. So I think building those conversations and that practice and that routine before the end of August is even really more paramount. And I think the other piece just to remember, and I think about it just to be truthful, being a staff member in the building, we had a little bit of a transition period. And for a period of time, we had kind of 4 days in the building, and then Fridays were remote. And obviously more recently that has transitioned into 5 days in person. But it's amazing, because I'll be honest, as an adult, like that first 5-day week, we were all tired. And so I think just trying to be cognizant of that for our kids is also really important too, because they're kind of out of practice. And it's going to take time to sort of build that endurance again, just not only from sort of that academic perspective, but also just the socializing perspective and the physical activity perspective. All of those pieces are going to take some time.
And if your child has been online and not at the school, I would encourage you now to reach out to the guidance counselor. Make you and the guidance counselor come up with a reason, a piece of paper that has, nothing to do with anything that could be mailed or emailed, and make a trip to the school outside of school hours. So just before or after school, do some in the summer, drive by the school, drive around the school. Like a lot of us has talked about, tell me something you remember. Who do you used to walk into school with? What would you guys talk about? I even tell parents, drop the kid off at the front of the building, have them walk up, touch the front of the door, do a lap around the building and come back, right, with the car, and then pick them up. I mean, really, some kids are going to need to walk into the school and walk around. And the schools know these things. So reach out and, work together to really get that process engaged.
I think another thing that's really helpful too is to remember their resilience from how they transitioned out of school to all of the online, and reminding them of how scary it was the first time that they were on a Zoom call and not wanting to put their camera on, or whatever those issues were. And do you remember how hard that was? And do you remember that day then when your teacher asked you just to click on your camera and you did it and you were so proud of, so helping them also to access ways that they have been so resilient to really manage this time. Again, I think that it became normative, but this has been huge. And so I think walking them through how they got here and saying, I believe that that's in there. And now we've got to figure out ways to remind your body that you knew how to do this, you knew how to do this. And, there are teachers there to help, there's guidance there to help, but to also help them access that sense of resilience where they overcame this in the beginning.
I also think from a practical perspective, a couple of things that we've been recommending to parents is doing like a family board where, because we're going to start picking up with activities, sports, clubs, things like that are going to start, opening again and be around in the fall. So who's doing what on what day, during what time, how are they getting there, who's driving them, who's picking them up, just things like that, especially for our little guys that have like ADD or ADHD, doing a picture of them maybe with all of their stuff for school, the things that they need, their backpack, their lunch, their, whatever else they might need, and just having it like up in their room and running through that a few times to make sure that they know what it looks like to be ready and that they're able to kind of do that on their own when things get busy or crazy. So just kind of tips in that way.
All right, thank you. Okay, so now we're switching gears because again, we really wanted to make sure that we ended in our last segment that we were giving everyone really tangible, parents, like tangible things, strategies, things to do that you could walk away and say, okay, this is something that I feel that we've very much so done that so far. But just to add to that, we wanted each of our panelists to share some resources, some to-dos, to leave us with tonight. And to actually start us off, I'm going to pass it over to Jan and Amanda to do activity with us. So, and I'm going to be surprised too. I don't know. So.
Me too. I just invite everyone just to take a moment and just put your hand on your heart. Just by putting our hand on our heart and just feel your feet on the floor, maybe even wiggle your toes, just feeling yourself connected to the ground. And just on your heart, just take a deep breath in and just sigh it out. And just with your hand on your heart, just right now, think of one thing that you're grateful for right now in this moment. And just take another deep breath in through your nose and just sigh it out. And just allow yourself to experience this moment of being grateful of maybe one thing that makes you smile, one thing that connects you to your heart, one thing that just brings you joy, and just feel that. Taking one more deep breath in and just sigh it out. And just this emotion of putting your hand on your heart actually activates your parasympathetic nervous system, which actually helps calm you down. So anytime you start to get all just like, just stop. Put your hand on your heart and think of one thing that you're grateful for. Amanda, you want to take it through another thing?
Just as we've been sitting here for a while, you might take a moment to notice your body. When we get stressed out, our body holds that stress. And so, yeah, I see Sarah moving her neck, and I want to invite us all to kind of move a little bit. So if it feels okay, take a breath in and sit up a little bit taller. Maybe move away from the back, whatever's supporting you on the back, if that's okay, to sit up away from that just for a moment. And then the next time we breathe out, let's just drop our ear to our shoulder and drop our shoulders down. And take a moment to breathe and notice how our shoulder, our neck is feeling. And then as we breathe out, we can bring our chin to our chest. Pause there for a moment, take a breath. And then we'll roll our other ear over to our other shoulder. And now I'm going to ask you to trust yourself and just start to move your neck in any way that feels good. You can close your eyes if that feels all right and look away from the screen for a moment and let your body talk to you, because it will. As you move your neck, notice what feels pleasant and what feels unpleasant. Maybe you find a spot that just feels so good, you want to hang out there and breathe there, and that's okay. There's no right or wrong way to move your neck, as long as you're taking care of yourself. And then when you feel satisfied with that, you can come back to center. Take a moment to notice if you can still feel that you moved your neck even in stillness. And let's move through our shoulders for a moment. Breathing in, bringing our shoulders up to our ears. And then as we breathe out, let's roll them back and down. So breathing in, we'll roll them forward and up. And then breathing out, roll them back and down. And just one more time. And when your shoulders land back and down, notice what it feels like to have your shoulders down away from your ears. Notice what it feels like to have your neck long. And you might feel that there's more movement that wants to happen in your body. Right? We've been sitting for a long time, so maybe you can just wiggle your toes or roll your ankles. Maybe take a breath in and reach your arms up overhead. And just kind of organically move from side to side. So a lot of times when we think about movement, we think that we need a lot of time. We have to roll out our yoga mats or go for a walk or turn on a video. Okay? Sometimes when we are building up with our stress, we feel anxious, we feel upset. Little movements like this, you can do at any time. And they make a huge bit of difference. So moving your spine, and our spine moves in 6 directions. So you can feel if you take your arm over to one side and then switch. So our spine can go side to side. It can go forward. So if you take a breath in and lift your heart up, and then take a breath out and round your back. Good. And then come back up. And our last 2 is just turning into a twist, looking behind you one way, and then switching. Awesome.
And then also I invite you, if it's comfortable and you're able to, I invite you to get up, because we have been sitting a long time, and just start swinging your arms. I was doing a workshop with a bunch of kids out in the park, and I said, we're just going to swing our arms. And it's these little kids just started walking down the hill, and they were swinging the arms. And just remember being so carefree of just swinging your arms and loosening your legs and just letting it go. It's like almost throwing and releasing anything that doesn't serve you right now, and just let it go. It's loosening around your shoulders, your wrists, and just letting it go. It's imagine just flinging out for your fingers what doesn't feel good anymore. And then just pause a second and just feel what you feel. And then if it feels okay, just start marching in place of just, lifting one leg and the opposite arm. And it's actually just, as if we're marching down the hill and just feeling what it feels like. And if it feels good, you can even tap the other, the opposite knee. And if you want to, you can even bring the other elbow. And if you want to, you can even take it into a little dance and get a little funky with it. And this is really fun to do with your kids, is just get a little funky and then just start shaking it out, just loosening it up and start to do your funky shaking it out dance. And this is really fun to do with kids because it's just being as silly, as goofy, and just shaking it out, one leg, the other leg, and just letting it go, just loosening it up. And then find stillness. Just notice how you feel. We just shook it out, we let it go. Anything where we were stuck, we just let it go. And have a little dance party with your kids. Okay, Amanda, back to you.
I know we don't, I want to turn it over to another participant, but you just take a moment to feel your body. Okay? Just notice what 2-3 minutes of movement, how it affected your energy level. Maybe you can feel a smile on your face. Maybe you feel your heart beating. Okay? And it's a huge shift to go from sitting in front of your computer to getting up. And like these little movements make a big, big impact. So thank you for being silly with us.
Thank you. It really does. You don't that's what you feel it. And then you're like, it's just so easy it's so tense, as I said. Thank you so much. So does anybody else, or I can kind of round robin if it's easier. Last of our panelists, like tips, knowledge, strategies, hands-on things that you can recommend. So I can, Jan, yeah.
I do want to do one more thing, is we do a loving kindness meditation that we always end our workshops and our practices with. And also to know that whatever you as a parent, or a grandparent or a caregiver, you're not alone in what you're feeling. And you're not alone in any suffering or pain that you've been feeling this year. And also your children aren't alone in what they're feeling. And they're also not alone in wanting to be happy and to want to be connected to others and wanting to live their life with joy. That's what, we don't wake up going, I want to be miserable today, and it's about Amanda, it's about Amanda. It's why I love her so much. Amanda, would you just take us through a brief loving kindness meditation that we can all, maybe feel, experience a little?
Sure. So I'll be quick. And if you want to bring your hand back to your heart, you can do that. And we're going to start with ourselves, because really what we put into ourselves is what we can give out, right? So however it feels right to repeat these words to yourself, just repeat them and notice how it feels to say to yourself, may I know that I am not alone in my suffering. May I feel supported, connected, and understood. May I be happy and healthy and safe. May I be peaceful and at ease And may I know that I am loved. And then acknowledging how that felt, no judgment. Sometimes it's really hard to offer our self-kindness, and then we'll just turn it on to our child, right? Because we're here as parents. And I know this gets hard because you have multiple kids and you don't know which one to pick, but just for the moment, turn your awareness onto a child, and you can do the other one later, and just see that child in front of you and offer the same kindness. May you know that you are not alone in your suffering. May you feel connected, supported, and understood. May you be happy and healthy and safe. May you be at ease and peaceful. And may you know that you are loved. Noticing how that feels, and then just imagining, this group at large. You don't see each other, but imagining all the parents in all the world that you know, that you don't know, and just may all parents know they are not alone in their suffering. May all parents feel supported, connected, and understood. May all parents be happy and healthy and safe. May we be peaceful and at ease. And may we know that we are loved.
And we do it for all school staff, school administrators, and school teachers.
Sure, may all beings, all school administrators, all people be happy, healthy, and safe. May all people feel connected, supported, and understood. May all people know they are not alone in their suffering. May all people be peaceful and at ease. And may all people know they are loved. Taking a breath, coming back to the screen. Thank you.
Thank you so much. Thank you. All right, our other folks that are here, we're still good with time. Last tips, tricks, words of encouragement that you want to share. Maybe let's unmute, or I can call in. Any resources, things to share? Gotcha.
So I just want everybody, all the caregivers, to remember that an anxious child will present as angry, will present as oppositional, will have a spaz out and chandelier go through the roof, like think of going through the chandelier. And so anger and agitation are very common external behaviors for children who are anxious and worried. So if your child is angry or agitated or talking back more than usual, there's probably anxiety going on. And so the other thing that's really important about that is when we are around people who are anxious, it's like slime. It gets on everything, right? I don't allow slime in my house because it drives me crazy. It gets on, it gets on everybody around them. So if you have an anxious child, you're going to feel anxious and irritable and not know why, and then be irritable about your kid being irritable. And it's this whole domino effect. So I really encourage parents to, if there's this pattern playing out of anger and yelling and things, you just feel like you're doing the same cycle over and over again, prepare for that pattern. Know that it's coming and it's going to happen. Don't try to avoid it, because it will rear its ugly head. And when it does, when you go to yell, Instead, let the air out. And that will actually shift the chemistry in your brain. So by not yelling and just releasing the air, you're doing the opposite action to anger. And it can be a very simple, prepared intervention that a parent can use to try to shift the pattern of anxiety and anger happening in a family when there's a lot of change going on.
Great.
Thank you.
Thanks, Dr. Benjamin.
Great.
Anyone else have anything to add? Last chance. No? Good.
That was wonderful.
Okay, Dr. Sinelli, I'm gonna pass it back.
Oh, thanks, Christy. Well, of course, I just want to say thank you. Thank you to all of you for joining us this evening. Thank you to our panel. I know that we covered a lot of information in a really short period of time, but I hope, and I know that for me, it was extremely helpful. Of course, there was so much that was shared that I wish I may have known 10, 15 years ago, would have come in handy. So I just need to go back now and make some apologies to my own children. But I want to say thank you, because we were so fortunate to have all of you here in our community and in our school, and willing to share your resources and your strategies with our parents and our community. And I know that we will be posting this information, as Chrissy mentioned, on the Downingtown Area School District website. You'll find this recorded program. We'll also be providing those of you that registered with some resources and links after this. And of course, on Communities That Care of Greater Downingtown's website and Facebook and Instagram and Twitter, we will be posting much of this information in the weeks to come, plus information all summer long as follow-ups. And then Christy and Sarah and I will be quite busy planning the parent programs for the fall. So as Sarah mentioned, summer's already quite busy in planning for next year, but we would hopefully be able to invite our panelists back again for some future programs, because I'm sure that all of you felt the way that I did, that this was an amazing evening. And I want to say thank you again to all of you for sharing your time and your expertise with us. And I think we're good then with everything, so that everyone have a great evening and a happy, healthy summer. And we will be in touch with you with some more programming coming up in the fall. Thanks so much. Take care.
Thank you.
Bye.